Um, my name is Jill McCrary. I am the field service rep for Territory 8, which is Macon, Albany, and everything in between. We've got Leslie Austin, Director of Provider Enrollment, here. She's going to present some, and then I'm going to pick up at the end. We are talking today about out of state telehealth. I'm sure I prompted this issue because I scream loud, and I have DCH here to help us answer our questions and follow through on what we may be having issues with. So I'm going to hand it over to Leslie. We will do our questions at the end if you don't mind. Also, you were given a survey. We would love for you to fill those out and leave them on your chair, and we appreciate you being here.
Hello, everyone. Good morning. To access the presentation, please visit our website, www.mmis.georgia.gov, provider information, provider notices and out-of-state telehealth enrollment. And that's where all the presentations are going to be for the Medicaid Fair in this particular area. The Department of Community Health's mission is to provide access to affordable quality health care to Georgians through effective planning, purchasing, and oversight. We are dedicated to a healthy Georgia. All right, today's agenda is going to be licensing and credentialing requirements for telehealth providers or telemedicine, admitting privileges, prescribing medications through telehealth, OPR, ordering, prescribing, and referring requirements, professional liability for telehealth medicine, and the enrollment application. All right, for telehealth, all providers must have credentials or a license. For Georgia, you have to have a Georgia Compact license. That's through the Georgia Medical Board. Or you can have the telemedicine license that's new with the Georgia Medical Board. All providers go through CVO or credentialing to be enrolled in Georgia Medicaid, regardless if you're out of state or in state. And again, you have to have the appropriate permit or licensing, Georgia Compact license, and all providers must enroll based on their license within the category of service. Telemedicine or telehealth services shall be subject to utilization review and auditing requirements. Providers must maintain documentation of all services provided through the use of telemedicine, telehealth in accordance with DCH policy. There's also a manual, the telemedicine manual out on our website under provider manuals on the telemedicine process and what it entails. The admitting privileges for providers. In-state physicians must have either their own admit plan or an alternate admit plan for someone who can admit on their behalf. Out-of-state providers who are going to provide telehealth services must have an arrangement with a local physician or a hospitalist group to admit on their behalf. This piece isn't required for radiologists. They don't have to admit anyone, so they don't have to have an admit plan. Radiologists only, though. Prescribing medications via telehealth. Providers may prescribe medications through the use of telehealth, but all prescribers, whether in-state or out-of-state, must have their own unique DEA or Drug Enforcement Administration certificate to authorize controlled substances. DEA regulations require practitioners to obtain a separate DEA license in each state in which they're prescribed controlled substances. So for example, all out-of-state providers must maintain a DEA license or certification for the state of Georgia. Out-of-state providers who do not prescribe drugs or controlled substances are not required to have a Georgia DEA. If you're not going to prescribe controlled substances, you can just write a letter on company letterhead stating this provider is out of state or in state, but they will not provide controlled substances uploaded where the DEA certification is required on the application. OPR providers are ordering, prescribing, and referring. The physician or non-physician practitioner who writes an order, prescribes a drug, or refers a member must be enrolled in Medicaid. And this is used to be submitted on the claim for example, a hospital. The hospital or program integrity must know who touched that member in all aspects. The provider's NPI number must be for the individual physician or non-physician practitioner and not for the organization or the business. When you submit the application, it will not allow you to submit an NPI 1 for 2, which is a facility, and vice versa. It will give you an error message. The physician or non-physician practitioner must be of specialty type that is eligible to prescribe, order, or refer. And a list of practitioners are on our website under provider information FAQs. And it's a list of categories of service who can OPR, order, prescribe, or refer a member. All right, professional liability insurance requirements. Each individual practitioner providing services through telemedicine is required to maintain professional liability or PLI in an amount of $1 million per occurrence, $3 million per aggregate. The physician cannot have a shared policy, but mid-levels can. They can have a shared policy. If it's a shared policy, the individual or umbrella policy must list each individual practitioner by name and clearly state the amount that they have. All right, the enrollment application. We're in the process of updating this for telemedicine providers, but as it stands today, you must list or choose out of state for an individual. I chose physician, and you click save and continue. List all your information regarding that provider, name, social security number, date of birth, if it's the gender, race, it's not required, social security number, FEIN number of the facility or business. You list a special or category service here. If they're going to do something other than physician services along with it, like health check, you click add and list the 600 category service there. Save and continue. List a specialty here. I chose radiology, pediatric radiology. Click save and continue. And here's where you need to let us know if it's a telemedicine provider. You're going to choose business location has to list out of state other. And you have to list, do you use telemedicine services? Virtual only, yes. That's how we know the process of the application as a telemedicine provider. We're in the process of updating out-of-state category. In the meantime, choose out-of-state emergency practitioner over 50 miles from the border. We're changing this to reflect out-of-state other for telemedicine providers. You list your service location, address, city, state, contact information, etc. All right. Just going to talk about how to contact your field representative in the territories. Does anyone have any questions? Yes, ma'am. I'm gonna go ahead and do questions. Do it. Thank you. When you submit the application, you have to attest for the insurance information. You have to list all the, so we don't require your declaration page. If you listed information that was incorrect or was below the 1 million, 3 million, that's why we requested or required your deck page. So the CVO denied it or we denied it? CVO denied it. Okay. There's a table. Did they give you the ATN? Did you give them the ATN? Okay. But did you give them the ATN? Okay. Since you gave them the ATN, I will get, who did you give it to? Okay, if you can write it down for me, then I can look at it. List your email address, or is it on the application? Okay, I'll email you what the status is and what's going on. I can look at it, and I can have it re-reviewed for you. Give me the one that's denied, and I can terminate or deny the one that's pending. Was it CVO approved? No, the first one was not CVO approved. I'll look at the second one. Did you upload everything on that one? So what's your category, sir? So you under 596, 590 or 660 ICWP? Okay. Just give me the ATNs and I can look at it for you. You're welcome. Mhm. Regardless if you're telemedicine or not, correct? Mhm. What services are they rendering? Because telemedicine is only for certain services. Speech therapy. So for speech therapy, for all under CIS 840, you have to have a license within the state of Georgia, 50 miles, or the state of Georgia. So we don't enroll out-of-state emergency therapists. Correct. Where are they going to render services? Because with therapists, they can render the services in the child's home, or they can have the child come into the office. So what's the service location? Where they're going to render services? It could either be the child's home or their home, and they're going to go to the child's residence, or they're going to render services at the actual facility. So where are the services going to be rendered? So you list the facility address. They will list, if you go into the child's home, they will list their address for therapists. Mm-hmm. You're welcome. Yes, ma'am. Yeah, that's why. That's why we did the presentation. So when I showed you this, that's going to eliminate Albert having to send me an email every week. So you're going to choose your business location, out of state other, and you have to choose yes to virtual only. That tells us it's going to be 100% online or virtual. And then you have to choose which we're changing, the out of state emergency practitioner 50 miles from the border. Yeah, this piece is. We're doing an update to the system. Hopefully it'll be in system by May or June. But this will show us if you choose virtual only and out of state other, that this provider is a telemedicine provider. You're welcome. Mm-hmm. Mm-hmm. Where's the provider located? You list their address. Mm-hmm. Yes, ma'am. And that's why you list here virtual only. Right there. Mm-hmm. Mm-hmm. Yes, ma'am. Hold on, they're gonna give you a microphone.
Oh, I'm sorry. If I were to move, and still have patients virtually in Georgia, do I have to, fill out all of this
For
separately?
therapists, you have to be within 50 miles of the Georgia border in order to render services to Georgia Medicaid members. The telemedicine piece, as far as if you're out of state, doesn't apply to therapists. It usually applies to physicians.
Only to physicians?
Mhm.
Okay, what about if you get what is it, an agent? I was trying to figure out what that term was. I'm sorry. I had it in front of me.
So for therapists, you have to be within the 50 miles of the Georgia border
Mhm.
or in the state of Georgia to render services, telemedicine.
Even if your license is here and the person is here?
If you're here, then you're rendering services here.
Right.
But if you move to Michigan,
Mm-hmm.
we can't keep you enrolled.
Okay.
Mhm.
All right, thank you.
You're welcome. Any other questions? We still can't enroll them. They have to be within 50 miles of the Georgia border or the state of Georgia. Within 50 miles. Any other questions? All right, Jill? Leslie?
All right, so contacting us, a field service rep, you want to log on under your provider number and do a contact us. These are the territories. So, and do remember this presentation will be on our website. So here are the reps for each territory. We have 2 hospital reps, north and south. Okay, then we have 3 statewide consultant reps. They step in and help with overflow, overload, complexity, that kind of thing. And then to do the contact us, of course, like I mentioned earlier, please do it under your provider number. Of course, you'll log in. You'll go to web portal. Contact information. Contact us. All right, the clicker has a delay. Okay, here we go. So you'll have a drop-down menu. You'll want to do all right, log in, web portal, contact us. All right, you'll want to choose contact my provider rep or request a provider rep visit. That's going to come to us. You want to give as much information here as you can. We are back on the road now, so we pretty early go make visits, deliver pathways material to providers so we can get more folks enrolled in it. How can we help you? You can put in your question. You can put in your ICN number. Whatever you need help with, you can put that in there. Now, an email address is very helpful. You see a phone number. A lot of times if you put a phone number in, make sure you put it in correctly because sometimes we get the wrong phone number. And email addresses, because like I said, we're on the road quite a lot. So if you give us an email address, when we get home in the evenings, get off the road, we always look at our contact us and we can follow up with you via email. I do want to say one more thing. DCH has put into practice with us from the get-go 14 years ago. Your contact us, we are given 72 business hours. I do not work 24 hours a day. Well, I do, but don't tell anybody. So please bear in mind, although it should never take that long, we do have 72 business hours. We are monitored by the Department of Community Health and our feet are held to the fire. So we definitely want you to do that. A lot of times, if you leave your email address, you'll end up with our email address. So that's really a super convenient way, because if you try to call us on the telephone, a lot of times we're on the road, and I'll be real honest with you, I am not techno savvy whatsoever. So I'm trying to punch on my screen on my car how to get you on the phone or answer your question, answer the phone. Forget your question. I'm trying to figure out how to answer the phone. So if you can do, if you can do an email or the contact us, we're going to get back with you because that is our main goal. We are here to keep our territory happy and we want you to be happy because we appreciate your